Joining us in the studio is Professor Paul Enck. He's a psychologist and he is an expert on placebos. Now, is it actually possible that a doctor with an uncaring attitude could make a patient even worse, an ill patient?
Oh, it definitely can do. Think about the idea of doing a wrong diagnosis. Patients develop symptoms immediately after they're getting the wrong diagnosis, and that will make them very sick for quite a while until this problem is solved.
Better choose the right doctor, I guess. Yeah.
Better choose the right doctor.
Can you judge how big a role placebos actually play in medical treatment?
Well, we know from drug trials that where we test a new drug or a common drug against a placebo, that on average the placebo response is about 40% of what we see in the drug arm. So about 40% of the medication response is attributable to placebo on average across all medical conditions. Some more, some less.
That's amazing. That is really a lot, isn't it?
Yes, it's a lot, yes,
Yeah.
yes.
Obviously, it has to do with the self-healing powers of the body. Can you explain to us what really happens in our bodies?
Well, I'm not quite sure about what that is, the self-healing power of the body, because placebos do not heal. Placebos just take your symptoms away. But what happens when you take a drug such as this one, and you expect this to treat your symptoms, but in fact it is empty or it contains nothing that can do that. Mm-hmm. What happens at two processes. One is expectation. You expect to improve your symptoms to be improved. And the second is your previous experience with similar drugs, such as blue makes you feeling sleepy, will continue to work for a while after you take an empty drug.
But that's actually then a process which should work differently with different illnesses?
Yes, this is true. In fact, placebos do simulate what the actual drug does, and therefore they also depend on that you once in a while take a real drug to make this work. The placebos do a pain placebo drug does do pain inhibition, but does not affect the immune system. If you take a drug for a common cold or for some other diseases, and then this is substituted by a placebo, this will work on immune functions, but not on pain.
So you wouldn't really feel comfortable in trying to heal somebody just with placebos? You wouldn't rely on that?
No, absolutely not. We don't know how long a placebo response works. We do know from drug studies that it can work up to a year, but in everyday practice it may only last for a few days. And then it has to be reinforced by giving drugs again. So the best you could get out of it is probably substituting every second, every third drug application by a placebo, or go below a threshold where usually the medication would work.
And of course it has to do with deception. I mean, if a doctor tells you, hey, this is a pill with only sugar in it, it might not work that strongly. So what's a doctor supposed to do?
Well, a doctor should not use placebos at all in his practice, because it is regarded unethical to treat a patient, to give a patient a drug that does not...
What if he tells the truth?
Well, that is something that is currently being tested in a number of situations where we could show that it still does do some benefit to the patient.
Thanks a lot for the talk.
You're welcome.